What's up, guys? It's Dr. Price, and I'm here with Action Potential Mentoring. And our goal is to help you perform at your absolute best. So we're going to crush all anxiety. We're going to get you the knowledge that you need and the performance that you deserve. So join me right now, and we're going to jump into some content.
Hepcidin hides the iron. Okay, so how does it actually do that? So it's actually going to block the iron transport. So it hides it by blocking iron transport. And so what is it that helps to do with iron transport? All right, so one of the big things is called ferroportin. All right, so ferroportin. And how I remember that is ferro, Fe, for iron. That's the abbreviation on the periodic table. And then portin, I think it's transportin the iron. So ferroportin literally tells you exactly what it does. All right, and so the ferroportin is often on your intestinal brush border. And so if I draw your intestines out like this, here's your intestines. I think of the ferroportin is right there. And so if your hepcidin is going to block that, okay, so now you can't actually uptake the iron. All right, and so now you can't absorb the iron. So if here's your GI tract, so we'll say this is your intestine. And where do you want the iron to get? You want it to get through here into your bloodstream, right? But if your iron is just floating around in your intestine, you can't uptake it because the hepcidin blocked that transporter. All right, so now you just basically poop out your iron. Big thing to know about anemia of chronic disease is if you understand this pathway where the acute phase reactant hepcidin causes ferroportin blockage, so now you can't transport the iron, it kind of makes sense that you're going to have really low iron levels. All right, so it basically causes an iron deficiency due to a chronic disease. Okay, so that's how you can walk through anemia of chronic disease in your head.
Thank you guys so much for joining today. If you found that was helpful, find me on Instagram at Action Potential Mentoring and shoot me a DM saying what your favorite part of today's lesson was. If you have any questions or you'd like some personalized one-on-one assistance with preparing for the USMLE, learning what it takes to become a stellar applicant and matching into your dream specialty, DM me the words VIP Mastermind. Again, that's VIP Mastermind. Talk to you soon.